Hi, Facebook friends. Helen Archontou here, CEO of the YWCA of Northern New Jersey. So happy to have some time with you today on this Wednesday. I know I always have to pause when I say what day it is because sometimes I'm not sure. But we're so glad that you could spend the middle of the week with us. We have a wonderful conversation planned for you today. And it's a little teaser for you because on Friday is our monthly Friendship Friday event for our senior community. And we thought that we would bring our wonderful speaker on today to talk, just to give you a sense about what we're going to talk about on Friday, in hopes that you will join us if it's a right fit for you. If not, to share it with someone in your life who you think will benefit. I know my mom registered for it, so I know it's going to be a great conversation. And so with that, I want to welcome Lynne Bennett, who is our guest today. And so the focus of our conversation is the realities that many of us are dealing with, caring for elderly parents or for seniors. Yeah. We know that they have their own unique long-term needs. And as many of you know, because I've shared it on the course of our broadcast, I've been caring for my 90-year-old mother in-house with me now since, although I've always taken care of her, but in March of 2020, she moved in with me. So she's been in-house with me for a while. And so I can absolutely relate to the need for these conversations. Navigating home health care is definitely challenging and has been even more challenging during this time, for sure. But that's what we're dedicating our Friendship Friday discussion with this week, which is July 16th on Friday at 11:30 a.m. There's no charge to register. We'll have the link for you here in the comments if you'd like to join us for the conversation. And we thought it was a great opportunity to explore the topic a little bit, since we know that so many of our senior community has been trying to navigate, and their caregivers have been trying to navigate some of these important questions. And so we were so grateful that Lynne, who is a sales executive at SeniorBridge, could join us this morning and as well prepare the program for us on Friday, so that she can give us, again, some highlights about the in-depth presentation we'll be having about home health care on Friday. She has worked for SeniorBridge Homecare for 2.5 years and has been in the industry for over 25.
Yep.
So that alone is something to talk about. I can't even imagine how much it's changed. So welcome, Lynne. Thank you so much for joining us.
Thank you for having me. Thank you.
So 25 years in this field, what changes have you seen over that time? I'm sure monumental.
It is monumental. I started my career, and I'll give you a little background. My ex-husband and I had a marketing agency, but I had always worked in medical facilities. I married the two and went to work in community and marketing and sales in senior healthcare. And my first foray was through a big campus that had a subacute and an assisted living. Went on to another assisted living, went on to a subacute, I worked for a hospital, I've worked for an ambulance company, and now I'm settled in home care. So I have the whole, banana. I can tell you a little bit about everything. And it does help because it all fits like a puzzle. It's just like a big, big puzzle. And what I've seen happen is it's become more specialized. Like everything has got doctors now. You can't just go see a doctor for just a general thing. You have to go to a specialized doctor who asks for a specialized service. Certain home cares specialize in certain, different types of modalities. They work closely with other companies now, where they used to just be a simple home care. You get an aide and come to your house. Now, you have aides. They have to be totally trained. They're licensed by the state. Agencies that you want to look for, and what I've seen happen now, have to be accredited, which is a huge step. We are CHAP accredited. There's a couple other agencies that do it, but I've seen them go from just a simple home care to where we have to have those criteria met and those kind of changes. So it's just moving forward and morphing into a more sophisticated type of service. The aides are still good aides. They're just, they are the backbone of our industry, and they do so much. That part hasn't changed. It's acquiring them, overseeing them, and the additional services and modalities that you can offer to them. As one example is care management. Care management has become a huge part of home care these days, where a care manager is a person, a social worker or a nurse who comes in and oversees a family that might need more direction and management and organization. And then the home care becomes the piece underneath it. So that's kind of where home care has morphed to.
Yeah, that's a big evolution over time, and that care management piece. I'm a social worker by training, so that's a modality we've always used in the social work world. But it's I think I can understand why this work has evolved there, because it really allows there to be a centric point to manage all of the pieces. Because the reality of it is, when we are dealing with our elderly family members and our family members that have a lot of different health needs, there's very often so many people involved and not always talking to each other. And, that can create some real serious medical challenges for the patient and the person.
Correct. You think of it as a team. We work as a team, and there's a team leader, and it doesn't always apply. You could have a simple home care case where you don't need it, but in many times, we find people where one client, part of the quotient is very, very needy and has, like you said, so many services that are needed. And who coordinates that? A family member doesn't know where to begin. So, But they kind of balk at it because it is an added expense, but it's a very valuable added expense. And I've seen that, care management, like I say, just gravitate toward, move and motivate toward those type of care practices where we're a little more specialized, overseeing the care of the aides and making sure that the entire family needs are met. So
you mentioned, that the expense of, sometimes, some of the services. And I know, seniors, are very often on fixed incomes and, trying to really manage the funds. Can you talk to us a little bit about, whether it's for the seniors themselves to think about this, or for the caregivers, like myself, who are trying to help manage, what should we be expecting to pay for services, and what are services that are free in this world, that we'd have to, navigate for support?
Not much free, unfortunately, but you mentioned a good point. When we folks are considering home care, really, you need to consider the caregiver, especially because many times we will put an aide or a healthcare, person in there to give the caregiver a break. That caregiver needs to get out to the store, go have lunch with a friend, husbands have to go play a game of golf, maybe have a card game a week. And with some of the care that's needed for family members, you can't do that. You just can't leave them. So sometimes we just hire or bring in a caregiver that is the additional support for the family member. Otherwise, it's based on the needs. When you hire a caregiver, we have a process that we have to go through where there's an assessment done. There's a charge for that, and it's a state requirement that we do that. But that assessment's important. Family members are involved in it, and they write a care plan off of it. And that care plan is what dictates the activities that the aide does. So we cover everything, and it's so everybody joins in and makes sure that we don't miss anything. But there's a charge for that. Then there's an hourly charge for an aide. And in the industry in Northern Bergen County and Passaic County, it ranges anywhere from $27 to $30 to $35 an hour. And I know that adds up very, very quickly. And many people base the amount of care that they can get on what they can afford. And it's certainly understandable. But it's almost all home care is private pay, almost all of it, unless there's what we call a certified need, which is a wound care, IVs, specialized care that a doctor would write a prescription for. And then there are services companies that are dedicated to doing that, and it's paid for by Medicare. But if you're looking for just a general aid, there's a range of services that they offer. They do what we call ADLs, which are the activities of daily living. And you're very familiar with that, which are bathing, walking, eating, cleaning, dressing. And then they also will do light housekeeping, cooking, and laundry. So you're not just getting, someone to come in and care for your loved one. You're getting someone to help manage the house. And of course, the number one priority is to take care of your client. But yes, it's an hourly rate, an assessment fee, and that's it. Some companies require contracts. Some people don't. My company does not. You just sign on, we do the assessment, we put an aid in place. The company tries to match the aid. We give them some head up information and they try to match that aid with the situation. If not, it can be replaced. And that's pretty much the cost explanation for home care.
Sure. That's great. Thank you. I guess the other thing that I often hear, and again, being a caregiver myself in the same way, but when I speak to others as well, is the whole fear of having someone come into your house, right?
Sure.
And you hear that, I get that from like my mom, when we suggest, certain services for her. And I also hear that a lot from people about having someone come in their house. And I think that is related to historically just, will someone care for my family member the way I want them to? Fear that from will something happen when they're in the house that, shouldn't happen. And also during COVID, right, there was a lot of fear about the germs on top of all those other fears. Can you speak a little bit about how, thinking through those, fears and making the decision about home care? Because I think that that's a lens very often that people are making these decisions through. And, there's probably some good framework, to be checking off in your head to help you feel more comfortable.
Sure. It's understandable. We've all heard the horror stories. The aide sits on the couch and eats a banana split while the lady sits in the bed and no care. It truly doesn't happen anymore. Our nurses and our clinical managers are in touch with the aides. They have to check in through a phone every morning when they arrive. They check out. And then the care plan that they follow, they have to now and then check in with those nurses that oversee cases. We have a nurse in the field and they, if there's a problem or an issue that they're not getting along, just say that aide feels uncomfortable doing things and that they don't feel they're being received well, they can bring that person in and help, maybe ease that situation. But the aides are vetted, they're trained because of this CHAP accreditation that we talked about. We have to be a little more careful with our training and ongoing. So we kind of pride ourselves on that. And we have, any indiscretion or anything that comes up, the aide is thoroughly investigated. If there's any suggestion of anything that's, not appropriate, well, we don't keep them. And it's to our benefit to keep aides that work well and get asked for. And we make sure that our staff is, upstanding and available to anybody that needs it for the care they need. It's hard to take a person and make them feel better about having a stranger take care of them. That's something that you can only happen with having it happen and get used to it. But I will say I had a 96-year-old man that I had, and he had a little peanut of a little aide that came in to take care of him. She was about 5 feet tall, talked in a whisper, and he says, I'm not going to like this. And by the end of their case, he didn't want her to leave. They become friends to that person. They become a companion. They become your substitute just to talk to. They don't become a stand-in for family member, but it often evolves into something that's a little bit more than just an aide taking care of a client.
No doubt that they really, can become such central parts of, families because of the work that they do. So again, we don't want to give away the whole show. We want people to join us on Friday. But for anyone who's contemplating joining us, what would you like to tell them just as the reason that they should think about, listening in?
Well, my program is called Facts and Fiction of Home Care. I think that seniors in general have a lot of misconceptions about senior health care. A lot of questions about, I do another one, which I'm doing, I think in the fall, something about Medicare, the ups and downs and what about Medicare? Because we all have these perceptions that perceive that we've got 100 days of Medicare in a facility. We've got all these things that we think, and it's not true. They need to be laid out and broken down as to what you can expect when you enter into a healthcare situation. And the same goes for home care. A lot of people call up and think that, and I'll just use this as one example, that insurance is going to pay for their home care. And as you asked, it doesn't. It's a private pay situation. So I do a program called Facts and Fiction about home care. And it goes through about 15 things that are instances that I bet most seniors think I know that, and they don't know that. So I want to set the record straight for them regarding the costs, the activities, where they can have home care, when they can have home care. And it has been really enlightening. I do a lot of it with the senior groups, and I've spoken several senior centers where I've done the program, and they all said, we didn't know that. So now you got to find out on Friday what you do know and what you don't know.
Well, and it's definitely important to learn. And, if the caregivers are around, they should sit in the room and take notes as well, because,
absolutely.
Very often we're the ones.
I'm sorry, I don't mean to interrupt, but I think the one thing I want people to understand is that be prepared with information. Do not wait until you're in the heat of a crisis. And you as a social worker know that poor decisions are made. So the more you know about what you're eligible for or what it costs or where to go to get it, you will not be caught, excuse the expression, with your pants down in the middle of a huge emergency, because you don't want that. You want to be able to think, oh, I have this resource, let me call them. And even if I'm not the one you use, most of us are really helpful at finding another agency or someone who can help them.
Yes. I mean, it is important, especially when people are thinking about planning their finances for their, later years. Just having a sense of the costs and being able to think about what to put aside, and very often thinking about what to spend elsewhere or give away to family members. To really make sure that they understand what costs might be ahead, so that they can plan for them, for sure.
You got it.
And I love the idea that you'll be back with us in the fall talking a little bit about, some of the insurance pieces that go along with this, because I can say, again, working, doing this alongside with my mom, the managing the insurance piece and the paperwork that goes with any of these services is really overwhelming, and you almost need someone, to just focus on that.
Yeah, short of going to a professional, at least I do an overview of what Medicare provides, what Medicaid provides, what you need. And it's just a general outline. You need to see a professional. I always tell somebody, if you're in the throes of, whatever this, see a good financial elder care attorney, not a regular attorney. An elder care attorney is absolutely a must. And this will just give them a little bit of what they're entitled to, again, and what you can count on when you're into this kind of a situation. Absolutely. Knowledge is helpful in this situation, especially with seniors. We don't do enough when a situation comes along when you need these services. We don't have enough knowledge, or the seniors don't have enough knowledge to really make good, educated and strong, decisions. So I hope in some way, shape, or form I can help them on Friday with home care, and then down the road a little bit with Medicare and Medicaid.
Yes. And to your point, which I think is, excellent and can't be reinforced enough, is that it's important to try to get this information before you're in need, so that you can plan for it, because, we've all been in situations where we've had to make very difficult decisions in crisis. And, those are the ones that you look back on and wonder, did I do the right thing? Because you really didn't have the time to, think them through and consider all aspects. So this is a wonderful opportunity for those of you, whether it's for you or someone in your life that could benefit, to come join us on Friday, learn about the options, and go from there.
I look forward to it. Thanks.
Well, we do too. And thank you so much for making the time today. And we look forward to the event on Friday. And again, for our viewers, the link is here in the comments. You can easily register if this is a topic that's important for you to learn about, or if it's if you're a caregiver, or if you're someone who might need the services yourself, or if there's just someone in your life that you think might benefit from it, please share this opportunity with them. You can copy the link and send them this broadcast so they can learn about it, or just send them the link to register for the class itself. There's no charge. And again, we have a very strong program for our senior community at the YWCA of Northern New Jersey, and we're very committed to helping support them in all aspects of their lives to create a very strong, healthy quality of life. So Lynn, thank you for helping us with that. And thank you again for joining us today and being able to fill in some, information here. For those of you who are with us, remember it's only Wednesday, which means tomorrow is another great day of YWTV. And Thursday is the day that we share the mic now with Black women in our community to be able to amplify their voices. And we have a great conversation for you planned tomorrow. So I hope that you can join us at 11 a.m. We will be having a wonderful conversation with Nikita Stewart. So thank you for blocking the time and joining us. And also, we hope tonight actually is the kickoff for our writers workshop called Your Voice, which is free of charge. Rachel Brenner and Sherry Pullum, two wonderful, wonderful writers, creatives, are going to be working with our workshop attendees. It's a few weeks, about a 4-week opportunity. You can come to all of them, or you can just pop into one of them. It's the whole opportunity to just learn how to journal, write, do some exercises to help you find your authentic voice. We also encourage you to think about, you have a 10th grader, young female in your life, rising 10th grader. Our Girls Leadership Academy is kicking off in September, a 10-month opportunity for them to meet some amazing women in our community, some mentors for them to look up to, and have some wonderful learning opportunities. And through our senior fitness, there's still plenty of opportunities for you to sign up for chair yoga, Zumba, Fit and Fabulous, virtual classes. We have some in-person classes that are at senior centers around the county. They're back to doing some in person. We're still doing some virtual. So we hope that you consider those as well. We wish everyone a great day, and we'll see Lynne on Friday. Lynne, thanks so much for joining us. We did a wonderful time chatting with you.
Thank you. Thanks for having me. See you guys Friday.
Yes, see you all Friday. Take care, everyone. Have a great day. Stay safe.